And welcome to UpToDoktora. So this is a special lecture, I guess, and I'm going to be talking to you guys today about Revalida and the Revalida experience. It occurred to me that during clerkship, and when you get to clerkship, that we have actually kind of no idea of what Revalida is really like and what it is, and we kind of go into clerkship knowing that it's just like this mythical process that we have to endure eventually, and we're not really educated or told much about the technicalities until the actual happening or the occurrence is nearby. So I'm hoping that this will assuage a lot of your fears, that, it will give you a clearer picture as to expectations and, what you should do to prepare and expect, and basically give you guys a lowdown on what your day will be like for both the written and the oral. So first thing I want to do is talk to you guys about what this presentation is going to be about. And the first thing is I'm going to talk about what the Revalida is, and what it means to me as a physician who's graduated from USTFMS. I'm going to talk to you guys about our written examination, the oral portion, which I'm sure everyone is already nervous about, so don't worry, take a deep breath. And then I'm going to go into some conclusions about what Revalida really is and the role that it plays in your clerkship experience. So first, I want to talk about the Revalida as a whole. We've heard about it since first year. We've heard about it from parents, from friends, from ates and cuyas, basically from anyone who's been through UST. We have heard about this Revalida. Stories are retold and rehashed time and again, and sometimes you even ask upper years to tell you about their Revalida experience once they've relived it. And you know that it's kind of relived depending on the experience. It's either a really joyful day or a day that's kind of traumatizing. So what is it all about? And that's kind of what I want to talk to you guys about. So for me, the Revalida is a tradition that, it's a beautiful thing. I know that a lot of people won't agree with that, and I know that everyone's experience is different. But for me, even with the stress that I endured, at the end of the day, I could not believe that walking into my room to do my presentation with the tribunal, I walked in as a medical student. And at the end of 5 hours, I was able to walk out with my tribe and my tribunal as colleagues. So that was something that really blew my mind. And until now, when I think about it, it gives me chills. So I'm going to go into other things that you guys might want to know. First, some key terms, because we talk a lot about Revalida, and these are just some words that are thrown around and everyone asks about them. So first, bunutan is basically the day that decides your fate. It is the day that your LOs go into an auditorium, and they basically, I guess it's a raffle. It's a huge raffle when dates and times are randomly selected for your oral Revalida. So all of you guys, the entire batch is numbered in groups of 3 from group 1 to group 100 and something. And then each of those groups are therefore known as tribes. And in the bunutan, each tribe receives the date of their oral Revalida and whether or not they're AM and PM. So, and they also receive their tribunal. So who will be those who are judging their performance that day. So your tribe are the people that you take the Revalida with. So that's 3 people under the same tribunal. And your tribunal consists of 3 consultants that make up what is your panel of judges for your oral Revalida. And so these are organized into the chair, who is the highest ranking member of the tribunal and usually the most senior. Then it is the second, and then the third member. So usually there are personality effects with the tribe, so they say, or the tribunal, so they say that the chair is usually the most senior, the second is usually the one that asks the most questions, and then the third is the youngest and is usually more pro-student, but that varies between tribunals. Then you go into AM versus PM. So basically all this means is whether or not you take your Revalida in the morning, so that means you go from 7 a.m. to 12 p.m., or in the afternoon, which is 1 p.m. to 5 p.m. And now this is in real life Revalida. I'm sure that the online was the same way, if I'm not mistaken. So that just remains, consistent throughout. The maleta is your giant luggage filled with books and references for case preparation. And so that's filled with all of your reference texts. So basically all of the official textbooks of the rotations that you'll be able to pick from. and any reference material. So UpToDate, CMDT, Harriet Lane Handbook, MIMS, any of those reference books that you would need would go into the maleta as well. During my time, we weren't allowed to have any notes or transes. It was just textbooks and reference books. And then finally, this phrase is thrown around a lot, the tough 10. So this is the group of consultants that are notorious for having failed people in their Revalida. Usually it remains pretty consistent, although lately it seems to have been varying from year to year. So ask around, we'll talk about that another time. So factors to consider when you're studying for Revalida are content. So like, what's going to be tested and how do I best prepare? Like, what content are you weak in? What content do you struggle with? Those are things that you want to consider when you're starting out. The other thing is your study style. Do you learn more quickly with like a group? Do you learn better when you're studying alone? Are you more of a visual learner? Are you an auditory learner? Do you need someone to teach you? Do you need to do something? Do you need to apply the information to learn it better? And what is the way that you learn the most efficiently? So you're going for quality, but you also need to go to quantity when you're studying for Revalida because you're basically going to be covering information from your first to fourth year. So that's something that you kind of like want to think about. Like for me, for example, I am more of a like auditory and visual learner. So I spent a lot of time reading, but then also like practicing my cases out loud and watching people practicing. So that helped me more than actually like trying to apply in real life. With regard to retention, you want to ask yourself, how much do you have to review in order to continue to retain said information? So for me, that meant that like I reviewed consistently daily because I have a hard time retaining information. I'm not a strong memorizer. So I had to continuously go over my information in a cycle so that it was constantly fresh. And then with time, you want to ask yourself, how much time do you have left? So how much time do you have left, but also how to make the most of that time. So these are things to consider. This is my personal study timeline. So at the start of clerkship, I started reviewing with my basics since they were my weakest subjects. I started with subjects like physiology, anatomy, and biochemistry, and it was because physiology I started with first because it's applicable to all rotations, and the book is the shortest. I used BRS. Then anatomy and biochemistry because they were more memorization heavy, and I had the hardest time with them in first year. So I picked those three and I got them out of the way and was able to go through the information a second time before the exam. Mid-semester, I began a second read through all of the information. So basically, I ensured within the span of 6 months that I was able to read all the information for written Revalida twice. Then I took the exam. Ours was January 19th in 2019. So took the written Revalida, was able to pass, thank goodness. And after written, I created a study schedule that allowed me to go through at least 3 emergencies and memorize at least 3 emergencies per week, and then every day I would review 2. So that kind of helped me get into the mood. I would also review a case or 2 a day, especially with the more common OPD cases. So that's something that I started to do after the written exam. And then finally, oral Revalida, getting that MD, and getting Revalid done. So of course, I do have to add that amidst all this craziness, I know the schedule looks insane, but I also was consistently praying, like 100%. Don't think I would have been an MD without St. Jude, and I am being 100% with you guys about that. So first comes first is the written. And the written Revalida is split up into basics and clinicals. So you have your first year subjects. I noted the heaviest subjects on the exam. So with first year, it was a lot of biochem, anatomy, and physio, as you would imagine. Then second year was pharma, patho, and super heavy on lab med. They are the most specific questions, and they are the most difficult questions, in my personal opinion. But then also, they like to throw in some clinep, prev med, and ethics. So that's great. In the third year in clerkship, which is the clinical side, you go through the top, like most clinical subjects, which is basically everything. So med, pedia, OB, gynec, surge. They touch on ANS a little bit. So like a lot of the concepts overlap in your third year clinical subjects. And then in clerkship, basically you build upon all that knowledge that you learned in third year, so they are able to ask you more higher order thinking questions, which is something that you want to look out for. And of course, in third year, don't forget your quote unquote minor subjects like legal medicine, forensic medicine, occupational health, and community medicine. The occupational health and community were questions I did not expect on the written. So it's easy points, something you want to look over. Don't waste every opportunity to get the points that you need. So don't forget those things. It's stuff that you can review like the week of, the day before, just make sure you get those questions because they add up. So this is the exam breakdown. So this is a breakdown of the day. Usually takes place in January on a Saturday. So like I said, mine was January 19th, and it goes from 8 to 12 with a short break in between the two halves. There are 200 questions total, and the breakdown of the subjects is usually given a few weeks prior to the examination. So the first half is all the basics. So that's all your first and second year subjects. It is 100 questions given over 2 hours. And then the second half, as you could deduce, is the clinical portion, which covers third year subjects and your information from clerkship, and also consists of 100 questions, and that's given from 10 to 12. What happened with me, well, I'll go into that when I go into my day, but this is what you should expect. Get there early, because what you're going to do is you're going to get there, and if it's not online anyway, you're going to get there and you're going to want to find your room, find your assigned seat, make sure that you have your testing number that's written for your exam papers, and, make sure you have an EAS, or make sure you're given your EAS when you get to the room. Things you want to bring are multiple pencils, a pen, some candy, prayers, of course, and your confidence. And if it's online, you can still do all of this stuff. Just make sure you guys have that brain power, that you have a good environment to take your exam, and that you go to bed the night before so that you can wake up early and have a good breakfast. So this was what my day looked like when I took my written Revalida. I got there at 7:30, and I started the first portion of the exam at 8 o'clock, so we started on time. After making sure everyone is in their correct assigned seats, that your Revalida number was correct, etc. So it's given much like the compre exams are given in first to third year. At 9, I finished the first portion of my examination and was told that I could leave the room and take a break, but to be back before 9:45. So I remember coming back around 9:30, I think. And they started the second portion immediately at 10 after like a 5 to 10 minute bathroom break. At 11:30, I finished the second portion of my exam, and I walked out of there like a queen and was excited and waited for my friends because we had planned a nice lunch to celebrate the end of our first step. So that's something that you guys may want to consider, or even like a Zoom lunch, things like that. Following written, this is when you start to think about your oral. And you do get a little nervous, but I want you guys to be sure to take a deep breath and remember that 1, you're not alone, that so many people are here to help you, and 2, that you're already doctors. This is just another stepping stone for all of you, and you're already smart. You already have the knowledge. It's just another day, another beautiful day in the life that you have chosen. So this is the ultimate test. So traditionally it's in person, takes place on campus, and you are within your normal schedule as this is going on. So you still have duty, you still have, hospital things to do, you still have conferences. So that's what makes it challenging in person. This past year it was conducted as online, similar setup. It had a more rigorous and stricter set of requirements and adjustments that were made for the new methods of administration. So batch 2020 can speak to that more clearly. Everything I know is only secondhand, so I don't want to speak too much on that, but it is a possibility. So if you guys are worried about that, I would ask your upper batch, and I would wait until you're done with your written, because remember, you can't take the oral without having passed the written. So the oral Revalida actually consists of 3 parts. You have your emergencies, then you go to the OPD, and then you prep and present your case. So this is something that I think a lot of people find abstract because you don't really think about it occurring during the time that you're thinking about oral Revalida. Like, you just think you're going to be sitting there for 5 hours and then dying. That's not true. You do go in, you present your emergency, usually no more than 20 minutes, talking to your tribunal. Then after that, you go to the OPD, you do your history and physical examination, That's 30 minutes. And then you have 30 minutes to prep and present. And then you present your case for what is another 20 to 30 minutes. So overall, a single person will probably spend an hour, give or take, with the tribunal. Or an hour and a half with the tribunal. So if there's 3 of you spending an hour and a half each, that's like 4.5 hours, which is why there's that 5-hour window. So for the emergencies portion, this is the process. You have 43 total emergencies. You pick 3, and then of the 3, you recite 1. And these are randomly chosen from either a bingo number shaker, so, that little basket wicker thing, or a random number generator. You have 20 minutes to present, and you need to include the following. So my advice for memorizing emergencies, which you guys can read or message me for more info as that time gets closer, is that to memorize a intro and definition, and then understand the rest so that you can speak from your mind. I think that makes it a lot easier and puts a lot of the pressure off, because they also sometimes like to interject. So at least if you're not memorizing a script like verbatim, then if they do interrupt you, you can get your train of thought back more quickly. So I also like to include every time that it is a bonus and impressive, especially if you're trying to get honors, if you are able to answer how you would treat your specific emergency outside of the ideal clinical environment. So for example, I had the emergency pneumothorax, which is number 19. I recited my emergency, did very well. I think I only got a 19 out of 20 or an 18 out of 20. And at the end was asked, how would I treat a pneumothorax if all I had was a first aid kit and I was in the middle of the street? So this is something that you can apply to every emergency, and I think it's very important that we as clinicians and as physicians do know this and take note of this and are able to kind of cop to it and tell them how would we do it if we only had XYZ. So I think it's an impress factor, but I also think it's very practical, because a lot of the time an emergency situation happens when it's unexpected. So that's just my 2 cents. Next, the OPD. This is generally like the clinical portion, but I split it into 2 because it feels like 2 different sections in my mind and in my experience. So you go on your walk to the OPD. You have 30 minutes to complete your history for that service. So for this part, I studied OPD forms to kind of give myself a guide as to how to do a complete history and physical exam for that specific service. Complete physical examination for the patient. So you want to go head to toe. It is important that you're able to go head to toe, and you can absolutely do a head to toe physical assessment in less than 15 minutes. However, in the interest of time, it is important that you make sure you get done the systems that are in question. So for example, if you have, say, what is presumably a cardiac condition, you want to make sure that, one, you get your cardiac exam out of the way, and then usually coupled with cardiac is your pulmonology exam, so your RESP exam. And then usually coupled with those 2, you could either go with your abdominal exam, which is important, and also an endocrine exam. So those are things that you kind of want to make sure, because as you're doing your history in PE, you're formulating your differentials and your actual clinical impression in your head. So these are the facts that will help you rule in and rule out your conditions and your diagnoses. And in all honesty, a large part of the Revalida a large part of the oral Revalida will circulate and will hinge upon your history and physical examination. So you could get the diagnosis wrong, but if your rationalization and logical thought process are present, you will still pass. Another thing to make sure is that you get all the quote-unquote must-haves. And what do I mean by this? Things like in pedia, never ever forget to weigh the patient. Never ever forget to obtain vaccination history. In OB, make sure you ask about the LMP. And if they're pregnant, make sure you ask for the EDD or calculate for it and know how to calculate for it. In OPTA, make sure you know and test for visual acuity before doing any of the other exams. So these are just things that you want to go through for each rotation and take note of. So after the 30 minutes, you take your stuff and you put everything away and you walk in a panicked method up to your room and you start to prep and present. So you have 30 minutes to prepare your case. You make sure you begin with your differentials and then your clinical impressions during your preparation, not during your presentation. I like to keep my clinical impression at the forefront of my mind when I'm prepping, because it is a guide for me. So for example, if we're talking about cardiac again, say it's palpitations and you're considering like either a substance thing, you're considering a thyroid thing, or you're considering just not a benign cardiac disorder, or like an AFib. So if I'm thinking hyperthyroid, then I want to make sure that I get enough information on hyperthyroidism to defend my case, defend why. So find information pertinent to your clinical impression that helps you to rule in and rule out the differentials, but also use your history and physical examination to rationalize and to logically deduce the information that you'll need for your clinical impression. So what I'm saying is, if your patient is saying that she has a history of, exophthalmia, if she has a history of, heat intolerance, and she feels shaky, she has tremors, she feels like she has palpitations, then you're kind of thinking, okay, this may be hyperthyroidism. So let me look at my physical examination. Is her skin warm? Do I notice any of the things that she has said? Do I feel like she has exophthalmia? Do I look at, does she have an enlarged thyroid? Things like that. So you are an information gatherer, and you are using this information to come to a conclusion, and that's the conclusion that you will defend. So the other thing I want to mention also is, if your condition, or if the patient's condition is one that has clinical practice guidelines, or that has ever-changing medication, or has new or advanced treatment, that's something that you want to include for brownie points if you're running. But it's good for us too, people who are average like me. So ensure that you are getting up-to-date information, and that the information that you're reciting and presenting to the case is as current as possible. So the biggest thing with regard to history and physical examination will always be to answer the question, why? Why did you ask that? Why did you perform the exam or maneuver? Why is that important? And then sometimes on top of that, they say, what were you looking for? Which is another way of asking why. So just remember to always be able to answer why. And if you do that, you'll be great. The focus of the oral Revalida is the history and physical exam. It is to assess your skill as a clinical clerk in the clinic from a clinical perspective, but mostly to assess how, competent you've become with your clinical eye. Can you make a deduction? Can you diagnose based on a good clinical history and physical examination? So those are skills that you want to keep honing and keep reviewing throughout this time. All right, so this is a breakdown of my day, pretty much by time. So I was the first person in my tribe, and you are usually listed alphabetically. And sometimes they do it randomly who's going to go first, but my tribunal, we asked them in advance to make sure, and they told us alphabetical. So I was the first person. So we met at 7. We started the Revalida. I started with my emergency, and after all three of us had recited our emergency, it was 8:30. We walked downstairs to go pick the rotation from a group of envelopes in the dean's office. I pulled pediatrics, so we walked to the OPD. I performed my history and physical examination and finished, and then walked back to our meeting place, which for me was the MIC. I began preparation at 9:05, and I finished at 9:35 and was called to present my case. I finished at 10. After you finish your case, they do not disclose anything to you, so you just say thank you and you walk out, and then you cry a little. And then you have to wait, if you are first, you have to wait for your 2 tribe mates to finish their presentations. So we finished at 11, I think, or 11:30, and then from 11:30 to 12, they deliberate, and at 12 o'clock, they call the 3 of you in, and they tell you that whether or not you passed or failed, and whether or not you received honors. So that is the decision making. Overall, this is your goal, that 100% of you make it through the Revalida. Because, again, I will reiterate, you are already a doctor. Revalida is just you doing your job, living your dream, and doing what you always do. If you think about it in terms of what we've experienced from first to third year, Revalida is just an MPPRC or a case presentation or an SGD that you recite by yourself. There's nothing scary about it, except for the fact that, you feel like the weight of the world is on your shoulders, because you keep thinking to yourself that, oh my God, if I don't pass this, I won't graduate. But guys, you've made it through the hardest years of medicine. So the goal with Revalida is just to make sure that you are competent enough to do a good job, and that you're willing to learn more as time goes forward. So remember, you're already a doctor. So it is an old tradition, and I don't believe it's one without value or merit. And I think it's because we consider ourselves to be the best for a reason. And while time has the power to take everything away, knowledge will always remain. So while we do get a lot of digs about being theoretically sound, and that's the only thing we're good at is theoretical, I say to that the board exams don't lie, and that every single year, when 98% of your students, 98% of 500 medical students every year pass the board examinations and move on to extremely great residencies in extremely well-rounded programs, and even abroad, I think there's a lot to be said about that. So take of that what you will, but that's just my 2 cents. And if you guys have any other questions, you can always reach out to me via email. So it's ongraymatters@gmail.com via the UpToDoktora podcast. And I just wanted to show you guys this picture on the left because it is actually my favorite illustration of the Revalida. It was done in my 2nd year of medicine, and until now, whenever I see it, that is exactly what it feels like, walking in with this weight of knowledge and walking out dressed in gold, holding the cap that you've worked 4 years for. So thank you all for listening. Thank you all for joining me during this talk. I hope that answered a lot of your questions, and I really, really hope that everyone is doing well. So until next time, this is Danny, and happy studying.